Welcome to PMHNPtesting.com and Clarity Education Systems. I'm Dr. John Rossi, and I am excited to guide you through this introduction to our Psychiatric Mental Health Nurse Practitioner, or PMHNP, Certification Review Program. Whether you're joining us for our on-demand or the in-person review course, you're taking a significant step towards becoming a certified PMHNP. Our review courses are designed with your success in mind, offering a comprehensive and engaging learning experience. We cover everything you need to know for the ANCC or the AANP PMHNP certification exams, making sure you're fully prepared, confident, and ready to tackle the challenge ahead. Our program isn't just about delivering content. It's about creating an interactive and engaging learning experience. Here's what makes us stand out from the other programs available. Our on-demand courses give you the flexibility to learn at your own pace. With 6 or even 12 months of access to the student course materials, you can pause, rewind, and rewatch any section as much as you want, making it easy to fit your studies into your busy schedule. If you prefer a more structured learning environment, our live in-person sessions offer a dynamic, immersive experience where you can engage with instructors and peers, ask questions, and participate in group activities. These classes and conferences are held all over the United States throughout the year. We provide 6 175-question practice exams to mimic the actual exam experience, helping you test your knowledge and identify areas where you need to focus your study efforts. Access to your materials, bonus content, and practice questions is through our intuitive student portal that's available 24 hours a day, 7 days a week. Now, I know the journey towards certification can be daunting, but remember, you are not alone. Our program is designed to support you every single step of the way. Whether you're just starting or you need that final push to get you across the finish line, with our guidance, dedication, and your hard work, you'll soon be certified. Now, we are accredited by the American Association of Nurse Practitioners, or the AANP, and our courses are approved for contact hours of continuing education, which includes psychopharmacology hours. They have been planned in accordance with AANP accreditation standards and policies. Again, I'm Dr. John Rossi, and I earned my Bachelor of Science in Nursing from Brigham Young University with a minor in gerontology. I then completed my Doctor of Nursing practice at the University of Missouri with a minor in nursing education. My capstone project was completed at an inpatient detox facility where I gained invaluable experience, and throughout my career, I've worked as a medical surgical nurse, served as a hospital inpatient supervisor, and managed a family practice clinic. Today, I am proud to be a practicing PMHNP dedicated to providing compassionate, evidence-based care. Let's kick things off by taking a closer look at the ANCC certification exam. Afterwards, we'll also take a look at the AANP exam. First, some good news. Approximately 91% of those who have taken the ANCC exam have passed. That's phenomenal. It means the exam is absolutely doable. And with the right preparation, success is well within your reach. To put this into perspective, compare that to the pass rate for family nurse practitioners, which is around 86%. As PMHNPs, we're doing really well, and it's a testament to the hard work and dedication that goes into preparing for this exam. For students who properly prepare, the odds are definitely in their favor. Now, to successfully apply for the ANCC exam, we have to look at some key documents. First is going to be your transcripts. This is both the official and unofficial transcripts. The unofficial can be downloaded usually from your student portal from your institution and then sent to the ANCC to kind of get everything rolling. But you are required to send your official transcript before you have permission to take the exam. This official transcript, it really won't be ready until after you graduate, and every school is different. Some it'll be online in about 5 days. Others it does take a few weeks. But that official transcript has all of your coursework, and it also has the date of the award when it was given. And that's your doctoral or master's level official transcript. That will need to be collected directly from the school. So you'll request it either in mail or electronic format, and then your school will send it directly to the ANCC. It can never go through you. Next up, we have the Validation of Education form. This is the VOE, and it serves as an official statement from your nursing program confirming that you have completed the necessary educational requirements for certification. This form must be filled out and signed by an official representative of your academic program, such as the program director or your registrar. The VOE form must include specific details about your program, including clinical hours, coursework, and the degree conferred. Your program's representative will typically complete this form after you have finished all required coursework and clinical hours. The completed form should be sent directly to the ANCC, either by your institution, or if they send it back to you, then you can submit it to the ANCC as part of your application process. Next up, we have the gap analysis form, and this form identifies any differences or gaps between your completed coursework and the ANCC's certification requirements. This form is usually required for postgraduate or doctoral candidates who may have completed a different education pathway or a different program like biomedical sciences and then decided to become an RN and then move to a nurse practitioner. So the gap analysis is going to ensure that the candidate meets all of the standardized criteria in order to sit for the PMHNP certification. This form must also be completed by your educational school, and it should outline any supplemental education or clinical experiences that were required to fulfill the certification prerequisites. And then similar to the VOE, the gap analysis should be completed by your program rep and then submitted directly to the ANCC. So this document, it may be reviewed in conjunction with your transcripts and VOE in order to assess for eligibility. Now, the VOE and the GAP form can both be downloaded from the ANCC's website when you go in to register to start the process to take the exam. Now, for the PMHNP certification introduction, the exam itself has 175 questions, of which 150 are scored questions. And these questions contribute directly to your final score. The other questions, or what we call the 25 preset questions, are questions that don't affect that overall score. They are included to evaluate their performance for possible future use in other exam updates. You will not be able to distinguish between scored and pretest questions during the exam, so you want to treat every question as if it counts towards your final score. The exam is worth a total of 500 points. To pass the exam, you must achieve a minimum score of 350 points. So the percentage equivalent here is approximately 70%. So of the 150 scored questions, you need to correctly answer at least 105 out of the 150 in order to pass the exam. There are specific content domains within this exam. First is going to be your scientific foundation. Second, advanced practice skills. Third, diagnosis and treatment. Fourth, psychotherapy and related theories. And then 5, ethics, legal principles, and cultural care. You can see here how they are split up into each section with the specific number of questions that will be asked. So for example, scientific foundation, there are a total of 33 questions, which covers 22% of the test. And then you add that all together, you get your 150 questions. So PMHNPs, we really have to have a general knowledge and a comprehensive understanding of various body systems because mental health can be influenced and can influence physical health and vice versa. So here's a closer look at each system that you must know in preparing for the exam. So you have to have knowledge of how the cardiovascular health impacts mental health, such as the effects of hypertension on anxiety and the cardiovascular side effects of psychotropic medications. You need to understand conditions like thyroid disorders and diabetes, which can mimic or exacerbate psychiatric symptoms such as depression or anxiety. Awareness of the gut-brain axis and how gastrointestinal health can influence mood and mental health, including the impact of psychotropic meds on the GI system. We need to recognize the effects of psychotropic and psychiatric medications on the renal function and understand disorders that can affect this system and present with psychiatric symptoms. Identifying conditions in the head, ears, eyes, nose, and throat are going to impact mental health, such as chronic pain and sensory impairments. Knowledge of how blood disorders like anemia can influence mood and energy levels, and how certain psychotropic meds can affect hematopoiesis. Understanding the role of the immune system in mental health is critical as well, including the link between inflammation and psychiatric disorders. Awareness of how skin conditions like eczema or cirrhosis can impact self-esteem and mental health. For musculoskeletal, recognizing the mental health aspects of chronic musculoskeletal pain and musculoskeletal side effects of psych meds. An in-depth knowledge of neurological conditions, things like epilepsy, multiple sclerosis, are going to help anybody that presents with psychiatric manifestations related to these neurologic conditions. For psychiatric, obviously a comprehensive understanding of psychiatric conditions, their pathophysiology, and how they intersect with the body systems. And then reproductive, awareness of the interplay between reproductive health, like the menstrual cycle or menopause, and mental health. And then finally, the respiratory system. So recognizing the impact of respiratory conditions like COPD, for example, on anxiety and panic disorders. So PMHNPs must also have a well-versed background in various pharmacological agents, not just psychotropics. And this is to make sure that we are able to provide holistic care. So remember, analgesics, these are pain management, and it's important in treating patients with comorbid psychiatric and chronic pain conditions. Knowledge of cardiovascular medications, including potential interactions with psychotropic drugs and their psychiatric side effects. Familiarity with endocrine agents, such as those for diabetes or thyroid disorders, which can influence psychiatric symptoms. Understanding how gastrointestinal medications interact with psychotropics and then their potential side effects that will impact mental health. Knowledge of musculoskeletal medications like NSAIDs or muscle relaxants and their potential psychiatric effects. Then there's the awareness of the neurological drugs like antiepileptics, so they play a significant role in psychiatric indications or side effects. The in-depth expertise in psychotropic medications is profound, including antidepressants, antipsychotics, the mood stabilizers, and anxiolytics, and their mechanisms of actions, their side effects, and known interactions with other drugs. And then finally, understanding respiratory medications, such as those for asthma or COPD, and their possible psychiatric side effects like anxiety and agitation. PMHNPs must also provide age-appropriate care across the lifespan, and this includes understanding the unique mental health needs and pharmacological considerations for each age group. So for infants, looking at the early signs of developmental and attachment disorders, understand how parental mental health can impact the infant. For school-age kids, we're looking at managing early childhood behavioral and developmental disorders, such as autism spectrum or early-onset anxiety. For school-aged, childhood psychiatric conditions like ADHD and anxiety disorders, and how to involve families and schools in the treatment process. For adolescents, we want to understand the unique aspects of adolescent development, including identity formation, substance use, and the impact of social media on mental health. For young adults, this includes the late adolescent and emancipated minors. Recognize the challenges of transitioning into adulthood, such as college stress, emerging adult disorders, and early onset of mood disorders. For the adult, we look at comprehensive care, including managing chronic mental health conditions, addressing life stressors, and then promoting that work-life balance. For the older adult, it's about the knowledge of geriatric psychiatry, including dementia, depression, and the complexities of polypharmacy. For the frail elderly, we need to understand the unique challenges of the frail, including increased sensitivity to medications, the impact of physical comorbidities on mental health, and end-of-life care considerations. The PMHNP certification exam really evaluates the candidate's ability to integrate knowledge of body systems, pharmacology, and age-specific considerations into clinical practice. All right, so here are the specific domains with each one of their specific breakdowns. We won't go over each one of these individually here because it's pretty general in nature, but make sure that you look at this in our program as well as going on to the ANCC's website. Some of the ones that I want to point out here for the scientific foundation are going to be advanced pharmacology, things like neurodevelopment, neuroanatomy, and then that advanced physical assessment. In advanced practice skills, you really have to know clinical interviewing, especially motivational, nonverbal communications, and open-ended questions. This includes health promotion, screeners, how to interpret screeners like the PHQ-9 and the GAD-7, the MSE, understanding and identifying the risks associated with suicide and homicide, recovery and resilience, risk assessment, substance abuse, with all of the appropriate tools and interpretation of, like the audit, the DAST, the CEWA, and the COWS. For the diagnosis and treatment, you have to understand the DSM-5 TR diagnostic criteria. We want to look at complementary alternative medications, diagnosing, how we implement evidence-based practice for both medication dosing, off-label use, and integration of psychotherapy. We need to look at selecting and monitoring for the psychopharmacological therapeutic management, as well as selecting and managing the pharmacy in general as it compares with things like cognitive behavioral therapy and other modalities that we'll use in conjunction with. And that brings us into the psychotherapy and related theories. CBT, humanistic, interpersonal. The change theories like the trans-theoretical model or Lewin's change theory, how the child and the adult develop and grow over time, family theories, and then this therapeutic alliance that exists between you and the patient with empathy, establishing boundaries, focusing on trauma. Finally, we have the ethics and legal principles with cultural care section. These are things like the Bill of Rights, informed consent, the scope of practice, understanding confidentiality, cultural and spiritual aspects, equity, diversity, and inclusion, so healthcare and mental health care for all, the ethics that are associated with decision-making, and patient advocacy. All right, now let's go ahead and get into the AANP certification exam. So the total questions here of the exam consist of 150 questions. Scored questions are 135 in total. These are the questions that will contribute directly to your final score. Pretest questions, we have 15, so these questions do not affect your score. They are included to evaluate their performance for potential use in future exams. Like the ANCC, you will not be able to distinguish between the scored and pretest questions during the exam. So it's crucial to approach each question as if it were contributing to that final score. So to pass the exam, you will need to answer at least 95 out of the 135 scored questions correctly. The percentage equivalent here, again, equates to approximately 70%. The AANP certification exam uses criterion-referenced scoring system, which means you are assessed based on your knowledge and skills rather than being compared to other test takers. All right, so to sit for this exam, the AANP evaluates the candidate's ability to provide high-quality psychiatric mental health care across the lifespan. The exam is divided into 4 key domains, each representing essential aspects of the PMHNP practice. So before you can get into that and go in and test, you do have to complete a minimum of 500 clinical hours in the PMHNP role in your general nurse practitioner program. Of those, your graduate work must say and must include that you did an advanced health assessment, advanced pharmacology, advanced pathophysiology, and role development in the PMHNP or the Psychiatric Mental Health Nurse Practitioner scope of practice. So those do have to show on your transcript. So you want to submit official transcripts from the accredited graduate program, complete continuing education requirements if applicable, depending on the state regulations where you are registered for an RN or where you will be registering for your nurse practitioner license. All right, so as we said, the AANP has specific domains. We have assess, diagnose, plan, and evaluate, and you can see how many questions are within those at 45, 28, and so on. They also divide it further into patient age categories, so you can actually see how many infant and child questions there are, being 8, pre-adolescent, adolescent, adult, and older adults. So when you add all those sections together, you get your 135 points. So domain 1, this is the assessment area. It assesses the foundation of effective psychiatric mental health care, and this domain focuses on gathering comprehensive information to form a clear understanding of the patient's mental health status. So here we have therapeutic alliance, comprehensive psychiatric evaluations, mental status exam and risk assessment, collateral information and patient records, along with evidence-based instruments and readiness for change. And that readiness for change is looking at a patient's readiness for change and to identify barriers of learning or care. Then we move over to the diagnosis section. This is going to be critical for guiding treatment and care planning. So we're going to focus on synthesizing assessment data to develop accurate and comprehensive diagnoses. So we're going to have an interpretation of tools, so screening tools, scales, diagnostic tests. We want to use these to consider our findings and align them with the patient's history and presentation to form a diagnosis and differential diagnosis. So that brings us to the differential diagnosis. We want to integrate subjective and objective data. We formulate a list of possible diagnoses, then we prioritize, and then we identify any urgent or emergent conditions that require immediate attention. Then there's primary and secondary diagnosis to establish any diagnoses that may explain the patient's symptoms and functioning. This identity is to see relevant secondary and tertiary diagnoses that ultimately may impact treatment or care planning. All right, our next domain is going to be the plan section. So here we have collaborative care, pharmacotherapy, psychotropic interventions, psychoeducation and health promotion, interprofessional collaboration, and documentation. And planning involves creating an individualized evidence-based care plan that aligns with the patient's needs and preferences. Okay, next up we have domain 4. Here we're going to utilize evaluation as an ongoing process to ensure the care plan is effective and adapted to the patient's evolving needs. So we have care plan efficacy, side effects and adverse events, patient adherence, quality improvement, and ethical and legal practices. All right, so we have the applied area for knowledge in the AANP. We've looked at all 4 of the domains. Now let's talk about what they're going to assess based on your applied knowledge. So scientific foundation, we need to understand the biological, psychological, and social sciences that are going to inform the psychiatric mental health practice. We have pharmacology. Obviously, this is the knowledge of psychotropic medications. That's going to include mechanisms of action, indications for use, contraindications, and then management of side effects. Non-pharmacological therapies, complementary and alternative treatments. This is going to be therapy modalities, lifestyle interventions, and supportive therapies. Psychotherapies, these are being familiar with the various psychotherapeutic approaches, things like cognitive behavioral therapy, interpersonal therapy, and family therapy. Assessing and diagnosing, conducting these comprehensive assessments, formulating differential diagnoses, and establishing accurate psychiatric diagnoses. This also includes care practice. We're looking at the proficiency in developing, implementing, and evaluating patient-centered care plans. And then professional role, awareness of ethical, legal, and professional responsibilities of the PMHNP. All right, another thing that the AANP does that I really like is it lists the disorders that are most frequently included in the exam, things like depression, anxiety, bipolar, trauma, substance, sleep disorders. They also have a somewhat included. This is going to look at schizophrenia spectrum, psychotic disorders, neurodevelopmental, obsessive compulsives, things like gender dysphoria, sexual dysfunction, feeding and eating disorders. And then we have our least frequently included section. These are going to be things that are a little more ambiguous and harder to differentiate or ask questions about. So you need to know these, things like elimination and paraphilic disorders, but they're harder to ask questions, so you probably won't see too many of these on the exam. All right. So I can understand how, this may be stressful and your current mood may be extremely high, but it's important to understand that the exam is a process, and preparing for the exam is a process as well. And so we're going to talk about how you can succeed, because you really can do this. It just takes patience, humility, and perseverance. You start at one point, you work your way through it, the marathon that's ahead of you, and keep pushing until the very last question on the test day, when you can complete it and feel confident in what you have done. Okay. So let's jump into how we succeed in your certification journey. This information is very important. So we want to discuss how to succeed on that path to becoming the certified PMHNP. First of all, it's about being confident. You've either just graduated or you're about to complete a graduate degree program. Give yourself some credit. You've already have a solid foundation of knowledge. While you may need to regroup and refocus your studies, remember that you know more than you think. Begin your review. Start by focusing your study efforts using the ANCC or the AANP test content outlines. These outlines are your roadmap, showing you exactly what will be covered on the exam. You want to gather a variety of resources and practice tests and reinforce your knowledge and identify areas that need more attention. We've done that for you. Then you want to create a study plan. So the accrediting bodies, they recommend starting your study prep about 6 months before your exam. You can choose to spend 6 weeks of daily preparation or even do a 2-week intensive crash course. It's all about what works best for you. So you want to write down your plan. You want to use hours if you go with clarity, but always keep it visible. Regularly revisit it, take breaks, and stay motivated. So we offer Microsoft Team private virtual study rooms where you can collaborate with others. The key is to use these wide variety of study materials, things like flashcards, videos, podcasts, whatever helps the material stick. And you'll find all of this on the student portal in the program. Now, please remember, you will not know everything, and that's okay. You want to focus on content you struggle with and then learn how to answer questions accurately. So this journey is about refining your knowledge and honing your ability to tackle exam questions confidently. Remember, this journey, it is challenging, but with the right preparation and mindset, you will be able to succeed. All right, so now let's take a closer look at some essential test-taking strategies that will appear that will help you approach your exam with confidence. We'll cover more of these strategies in our seminars, but here's a solid starting point. First and foremost, always choose answers that prioritize the client's needs. This approach keeps you centered on providing the best possible care. Then we pay close attention to the specifics like the client's age, gender, diagnosis, length of illness, and any symptoms that are mentioned in the question. These details often hold the key to finding the correct answer. You want to be cautious with absolutes, so words like always, never, all, every, only, must, no, except, and none. These can be tricky. Be extra careful when you see these terms. They often indicate answers that may be incorrect. 4, you want to look for keywords. Watch for things like first, best, priority, assess, or intervene. These words are going to indicate what the question is really asking, and it's going to refer you to that ADPI process, assess and diagnose, so on and so forth. Then you want to read the question carefully. Try to answer it before looking at the other choices, and then compare your personal answer with the options that are provided. Trust yourself. Select your answer, and then leave it alone. Do not change it. You want to assume nothing. Only use the information provided in the question. If it's not in the question stem, it is not a part of the problem. Don't add any extra ideas or assumptions. So it's perfectly fine to answer the questions you know first and then come back to the harder ones later. Just remember, you must answer all the questions or it will count it wrong and will count against you. Always, always, always remember that culture plays this significant role in nursing care. Consider this when choosing your answers when it applies to a culture or a specific group of people. All right, so you want to see the root action, identify the root, and then you want to look for what the question is actually asking in that stem. Are they asking you to assess, intervene, or plan? You want to match that answer to the action required. And so that's going to help keep you on the right track. Now, critical thinking is very key here. Always apply critical thinking. Look beyond the surface and consider what the question is really asking. If the answer suggests referring or consulting, it's usually not correct unless the question clearly indicates that you need outside expertise or if it goes outside your scope of practice. Safety is priority. It's almost always the right answer, but remember that it doesn't take priority over airway, breathing, and circulation, or the ABCs. So always keep ABCs in mind when answering safety questions. Pay attention to initially. If you see the word initially in the question, think about the ADPI process. So assessment, diagnosis, planning, implementation, and evaluation, and then start with assessment first. Always choose answers rooted in evidence-based practice. So this is crucial for providing that high-quality patient care and will often lead you to the right choice. Actually look for the words evidence-based practice when they're talking about an intervention option. You want to use the test site tools, so take advantage of any tools provided by Prometric at the testing site. These tools can help you highlight keywords. You can eliminate wrong answers by scratching them out, or you can mark questions to return to later. Now, interprofessional collaboration is very important. So you want to collaborate, and that is always encouraged. So when in doubt, choose options that involve working with other healthcare professionals. Now, be cautious with delegation. Delegation is often the wrong answer. Don't pass that buck unless it's genuinely outside your scope of practice or presents some type of safety concern. You always want to take action. Never choose an option that involves doing nothing. You're there to take action, even if it's as simple as monitoring and reassessing. So avoid the unfamiliar. If you read an option that you've never heard of, don't select it. Trust your knowledge and training. Then we have choose the most unstable patient. So when deciding between patients, always prioritize the one who's the most unstable or at the greatest risk. They need your attention first. Assume staffing is unlimited when you're answering these questions. You can assume that everybody is available for you, and you never have to worry about not having the people that you need. So don't let that be a part of your decision-making process. Remember, restraints are the last resort. Always use restraints as your last option. You want to choose the least invasive and least restrictive choice first, ensuring the patient's dignity and safety remains intact. All right, so that's a general overview of the major test-taking strategies. We go over how to go through each question systematically while we do the seminars in the program. So a quick synopsis here. Remember, we want to understand the question that we've been given. Take your time to fully acknowledge and know what the question is asking before jumping into the answer choices that are provided. And so this is going to help you avoid common pitfalls. Eliminate those wrong answers. Cross out obviously incorrect ones. This is going to increase your chance of selecting the right one from the remaining options. We call it our 50% rule. Identify keywords such as first, priority, best, and initial. You want to guess strategically. If you're unsure of what the answer is, make an educated guess. Eliminate wrong answers first that you can find, and that's going to help improve those odds. Go through the exam and answer the questions you know right away, then circle back and tackle the more challenging ones. Answers that are absolute, like always, never, only, or must, are often incorrect. Look for patterns. If you notice two or more answers that are very similar, one of them might be right. So pay close attention to those slight differences. Use the process of elimination. So eliminate choices that don't fit the question or contradict the known facts. Narrow it down. That's going to help you have a more informed decision. So watch for those qualifiers. I want you to look out for qualifiers like most likely, least likely, or best. These words indicate the level of certainty required in order for you to answer correctly. Manage your time. Keep an eye on that clock and pace yourself. Don't spend too much time on one single question. Mark it and come back later if you need to. If time permits, review your answers, but only change them if you have a good reason. Your first instinct is often correct. All right, take deep breaths. Stay calm. Maintain your focus. Anxiety can cloud your judgment, so keep a positive mindset. And then finally, and probably the most important test-taking tip I can give you is to practice sample questions. So the best way to prepare is by practicing with samples. And this is going to help you become familiar with the format and then improve your test-taking skills. So by mastering these strategies, you'll be well equipped to navigate the exam confidently and efficiently. Remember, you've got this. And with the right preparation, success is just around the corner. All right, so let's put these ideas into practice. Let's take a look at this practice question. So I'm going to identify keywords. I'm going to rephrase it in my own words. I'm going to come up with an answer that I think it is, and then I'm going to go through each answer selection and eliminate them or keep them for consideration. So Sam is a 10-year-old male who presents to the PMHNP for evaluation of attention deficit hyperactivity disorder, or ADHD. His parents and teacher completed the Vanderbilt ADHD rating scales and returned them to the clinic. The PMHNP considers the clinical interview, assessment, and rating scales and gives a diagnosis of ADHD. Prior to starting a stimulant medication, what needs to be assessed? So all this question is asking me, a 10-year-old male has been diagnosed with ADHD. Before I start a stimulant, what do I need to assess? And then I go through each answer one by one. A, how the patient did on a non-stimulant trial. So while a non-stimulant option may be considered here, they are not mandatory first steps prior to initiating a stimulant medication unless contraindications are present. So I have to get rid of A. All right, B, assess for family history of CVD and order an electrocardiogram or ECG if present. So I like this question so far. It's an assessment. It talks about heart problems with a stimulant. I remember studying that. So I'm going to keep B for now. C, vital signs and begin the stimulant medication. All right, again, I like vital signs. It's an assessment. I'm jumping right into the actual intervention, so maybe this one's correct. I'm going to keep it for now. Or D, assess for family history of autism spectrum disorder. So while it's important to gather a comprehensive family history, ADHD treatment is not directly influenced by a history of autism spectrum. So I can get rid of D. And that gets me down to my 50%, B and C. So based on this information, I'm going to make my educated guess here, and I'm going to go with B. So before starting a stimulant medication, it's essential to screen for any cardiovascular disease in the patient's history or in that family history. Stimulant medications can increase heart rate and blood pressure, so obtaining an ECG is recommended if there are risk factors or concerns. So why was C wrong? Although monitoring vital signs is important, it is not sufficient without assessing for a history of cardiovascular disease. And that's how you'll go through these practice questions, systematically and one by one. All right, let's move on to talk about what you can expect on exam day at the testing site so you're fully prepared and you're confident. On-site testing only. The ANCC, the AANP exams are conducted in person. COVID days are over, so you'll be in a large room with other students, each seated at an individual computer with separate cubicles. You'll be required to store all personal belongings before entering the testing area. However, you are allowed to bring a jacket in case it gets chilly. So the hospitality and cleanliness of testing sites can vary, so be prepared for different experiences within the testing administrators. If you need to assess that first, actually go to the site and see if you're comfortable there. So before entering the testing area, you'll be searched and photographed. This is a standard procedure to ensure exams security. You'll be given a dry erase marker and a whiteboard to use as a scratch pad during the exam. You want to make good use of it for jotting down notes or working through complex questions. You'll have time at the beginning of each exam starting periods to read through the instructions. So take this time because it doesn't count towards your total exam time. So you'll use it wisely to make any pre-exam notes on your scratch pad. You can mark questions, cross out answers, highlight words in the question text body. These features are there to help you focus and manage the questions more effectively. A timer will count down during that exam, so you're allowed to take restroom breaks or short pauses at your desk, but be aware that that timer will keep on running. So once you complete your exam, the system will ask you multiple times if you're ready to finish. And this really stressed me out because I kept thinking, well, is the computer telling me something? Do I need to go back and re-answer questions? That's not the case here. They just want to make sure that you're ready to finish, that you've looked at everything, that you're ready to push continue. And if you are, you're just going to go ahead and continue exiting out and finishing the exam. So your pass or fail results will display immediately. If you do not pass, you'll receive instructions on when to expect a section breakdown to help you prepare for retaking the exam. And you'll be able to retake it after a 60-day period for the ANCC. All right, so once you pass, you'll receive that much anticipated gorgeous green check via email within about an hour. And you will find out immediately for both the ANCC and AANP exams. All right, so that's the main thing to know about the exam testing sites. And this is an example of a schedule that we keep for a 6-week plan or a just-in-time 2-week plan. Students will just repeat the 6-week plan if they're studying for 6 months to a year. You can tweak this any way that you need to, and it is available for download so that you can manipulate it or put it up on your wall while you're studying your information. Okay, so one other thing that I wanted to add here, and I'm not pushing any of these products. I do not make anything when these books are sold. These were just extra study tools that I thought were super beneficial because I use them in clinical practice daily now, even way after my exam. But these are really great resources if you need to dive deeper into certain things that maybe aren't as prevalent in your mind. So the first are going to be the memorable books. So memorable Psychopharmacology, memorable Psychiatry, and Neurology. Dr. Jonathan Helt does a great job explaining these topics. They're beautiful books with lots of great examples, highly recommended. Then we have the Clinical Psychopharmacology Made Ridiculously Simple. It is a very thin book. It'll get you through psychopharm with very clear points, just the facts that you need to know. And then finally is the Psych Notes Clinical Pocket Guide. This is that little green one down there on the bottom row. This is by a nurse practitioner, Darlene D. Peterson. It's kind of a waxy coating. It's small. It fits in your lab coat pocket, and I refer to it every single day in practice. And all of these are going to help you learn a little bit more and identify key areas more if you need extra study. And then obviously you got to have that DSM-5. It is critical. It is vital for you to understand all of these disorders that our patients are dealing with. Okay. So as we jump into this next section, we're actually going to give you an example of one of the classes, one of the seminars that you'll find in the program. So this is great info for you to study now, but there's way more inside the actual seminars. So as PMHNPs, understanding drug-to-drug interactions is going to be crucial to ensure the safe and effective treatment of our patients. So let's start by looking at the basics and examining 2 key concepts. First up here is going to be pharmacokinetics. So pharmacokinetics is all about how the body interacts with a medication. It's essentially what the body does to the drug. This process includes absorption, distribution, metabolism, and excretion. So by understanding pharmacokinetics, we can predict how a drug will move through the body, how long it will remain active in the body, and how it will be eliminated. Next up, we have pharmacodynamics. So on the flip side here, pharmacodynamics is about how the drug affects the body. You can remember this because pharmacodynamics, spelled with a D, is the same as drug effects, spelled with a D. It looks at the molecular, biochemical, and physiological effects that the medication exerts once it's administered. In other words, it's what the drug does to the body. This includes how the drug binds to receptors, its mechanism of action, and the resulting therapeutic effects or their side effects. So understanding both pharmacokinetics and pharmacodynamics is going to be key to managing drug-to-drug interactions, ensuring optimal therapeutic outcomes, and by minimizing potential risks for our patients. So throughout this review, we'll explore these concepts further so you can confidently navigate the complexities of medication management in your practice. All right, then we need to identify what substrates and drugs actually do. Substrate and drug is an interchangeable word. So understanding how different drugs or substrates interact with receptors in the body is critical for breaking down the pharmacological concepts. So we're looking at the agonist, inverse agonist, partial agonist, and antagonist effects. So first up, an agonist is a drug that binds to a receptor and activates it. Agonists activate, opening the ion channel and initiating a biological response. Think of it as a drug turning on the receptor, leading to a full activation of its effects. In simple terms, remember, agonists activate. Then we have an inverse agonist effect. This binds to the receptor, but this drug causes the opposite effect of an agonist. So instead of opening the ion channel, it closes it or reduces its activity, leading to the opposite response. So remember, an inverse agonist creates an inverse or opposite effect. All right. So an inverse agonist example, let's go ahead and give one of those real quick here. This is like propranolol. So propranolol, a beta blocker, it's used to treat high blood pressure and anxiety, and it acts as an inverse agonist in certain beta receptors. So instead of activating the receptor, propranolol binds and reduces the activity. And this produces an opposite effect of what the typical agonist would do. It essentially slows down the heart rate and reduces blood pressure. Let's talk about an agonist example as well, jumping back up to that first point. So one like albuterol would be an example, a common medication used for asthma. So it's a beta-2 agonist, and it binds to beta-2 receptors in the lungs, and it activates them. And this causes muscles in the airways to relax, which helps open up those airways and make breathing easier. So this is a perfect example of how an agonist activates a receptor to produce that desired effect. All right, jumping back down to 3, we have our partial agonist effect. So a partial agonist is a bit different. It binds to the receptor, but it doesn't fully activate it, resulting in a less potent effect compared to a full agonist. It's like turning the receptor on, but only halfway. So partial agonists are often used because they can provide some activation without the full effect, which can be beneficial in certain treatments. An example here would be let's see, buprenorphine. So this one's often used for opioid addiction treatment. It's a partial agonist at opioid receptors. So it binds to the receptors and it activates them, but only partially. And this provides pain relief or reduces cravings without the full euphoric effects of a stronger opioid like morphine. So this makes it safer and less likely to cause dependence. All right, and then we have our fourth, our antagonist effect. So an antagonist binds to the receptor but does not activate it. Instead, it blocks or prevents other substances like agonists from binding and triggering a biological response. Antagonists essentially turn off the receptor or keep it from being activated. So naloxone, this is a commonly known as Narcan. It's an opioid antagonist. It's going to bind to opioid receptors, but it doesn't activate them. Instead, it blocks the effects of other opioids, such as heroin or other prescription painkillers. And this is used to reverse opioid overdoses. So by preventing other substances or opioids from binding, naloxone quickly stops the dangerous effects of an opioid overdose. And understanding these concepts, these 4, is crucial in prescribing and managing medications effectively, as they help us predict how a drug will interact with the body and what kind of response it will typically produce. So as we move forward, we'll explore more about how these effects play a role in psychiatric treatment. So the half-life of a medication is the amount of time it takes for the drug's active substance to be reduced by half in the body. So for example, if a drug has a half-life of 8 hours, that means in 8 hours, half of the drug's active substance will have been metabolized or eliminated. So this concept is essential for determining how often a medication should be taken to maintain its effectiveness. And that leads us to the steady state. So the steady state is achieved when the amount of drug being eliminated from the body between doses is approximately equal to the original dose administered. So this balance is going to ensure that the medication maintains a consistent therapeutic level in the bloodstream. So medications are typically administered once every half-life to reach and maintain this steady state. It usually takes about 5 half-lives to achieve a steady state, meaning that after starting a medication, it may take a few days or even weeks before the drug reaches its full effect. Similarly, it takes around 5 half-lives to completely eliminate a medication from your system, which is known as the washout period. So this period is crucial when switching from one medication to another, as it's going to reduce the risk of interactions or side effects. Now, it's important to allow time for medication to break down, not regenerate, before starting a new one. By understanding these concepts, you can make a more informed decision about dosing, about switching medications, and ensuring your patients achieve the best possible outcomes. All right, moving on to inducers and inhibitors. So when managing medications, we must understand the roles of inducers and inhibitors, as they can significantly impact how drugs work in the body. Inducers first. So inducers, spelled with a D, just like the D in inducers, are substrates that increase the activity of enzyme responsible for metabolizing drugs. So inducers, spelled with a D, decrease the amount of drug in the blood because it's metabolized quicker. So when these enzymes are more active, they break down the medication faster, these P450 enzymes, which is going to result in decreased serum drug levels. This means that the medication may become subtherapeutic. Essentially, it's just less effective because there's not enough of the drug left in the bloodstream to produce the desired effect because of the other drug, the inducing drug, that the patient took. So an example here would be St. John's wort. It's a well-known inducer, and it can reduce the effectiveness of certain medications, such as antidepressants or birth control pills. Next up is inhibitors. In contrast, these inhibitors slow down the activity of enzymes that metabolize the drugs, leading to increased serum drug levels. So inhibitors, HI, spells high, so high or increased drug levels. So this really means that the medication can accumulate in the body, potentially reaching subtherapeutic levels, supratherapeutic levels, which is going to increase the risk of side effects or toxicity. An example of an inhibitor would be grapefruit juice. This is a common inhibitor that raises the levels of certain medications, such as statins or benzodiazepines, making them more potent and potentially dangerous. Now, understanding the impact of inducers and inhibitors, this helps you ensure that medications remain within their therapeutic range, allowing for safe and effective treatment. Always be mindful of these interactions, especially when managing multiple medications. All right, so here is an example of our P450 or cytochrome P450 enzymes. This is a chart that we utilize to help understand the different substrates or drugs, inducers, and inhibitors. We'll talk about a lot more of these whenever we're actually in the seminars in the courses. So your CYP, for example, 1-alpha-2, 2-Charlie-9, 2-Charlie-1-9, 2-delta-6, and 3-alpha-4. Then we have the substrates or the drugs that are metabolized by those CYP enzymes. And then in the inducers and inhibitors bracket, we have the drugs that will either increase or decrease the metabolism of those drugs because of its effect on the CYP enzyme. And you'll take a lot of questions about this in the practice exams to help you understand and memorize these concepts. So let's discuss some of the main inducers that we see here. This is an acronym that I like to use as Bull Shark Crap GPS Plus. This is going to help you remember barbiturates, St. John's wort, carbamazepine, rifampin, alcohol, phenytoin, grisofluven, phenobarbital, sulfonylureas. And the plus there is smoking and the pill. So these are your inducers. Remember, inducers decrease the amount of the other drug in the bloodstream because they increase metabolism of the enzyme. So let's talk about an example here. So smoking acts as a cytochrome P450 inducer, right? Which means it speeds up the metabolism of certain medications, resulting in those lower serum drug levels. So this often means that the patient who smokes may require higher doses of their medications to achieve the desired therapeutic effect. But if the patient decides to quit smoking, the inducing stops. So this means the medication will no longer be broken down as quickly, that other drug, leading to increased serum levels. So if the clinician doesn't adjust or decrease the dose, there is that risk of the medication reaching supratherapeutic levels, which can cause side effects or toxicity. So, for example, if a patient on an antipsychotic medication like olanzapine stops smoking, the clinician must monitor and adjust the dose accordingly to prevent potential overdose symptoms. So this example highlights the importance of understanding inducers and inhibitors, ensuring that the treatment remains safe and effective as the patient's habits change. All right, then we have our inhibitors. The three main ones that I want you to remember today is big frickin' problems, the BFPs, bupropion, fluoxetine, and paroxetine. Remember that these medications, when you take them, may inhibit another drug, and that's going to increase the amount of that other drug in the blood system because it decreases the enzyme's metabolism of that other drug. All right, there are a lot more of the inhibitors, and you'll learn those in the seminars. All right, let's go ahead and try this question. A substrate is a drug which is metabolized by cytochrome enzymes. Which enzyme is known to metabolize clinical drugs such as duloxetine, mirtazapine, clozapine, Haldol, olanzapine, and methadone? Is it A, CYP1 2, B, CYP88 delta, C, CYP034, or D, CYP3 4? All right, so the correct answer here is going to be A, CYP1 2. So CYP1 2, this is a key enzyme involved in the metabolism of drugs such as those listed here. Now, the 88 delta, this is not a commonly known enzyme involved in metabolism of clinical drugs. The 034, this is just kind of mimicking the 3 alpha 4 to throw you off. There's no such enzyme by that name involved in drug metabolism. Now, the 3 alpha 4 is definitely a CYP enzyme. It's one of the most common enzymes involved in drug metabolism, but it does not specifically metabolize all the drugs listed in this question. So this question tests your knowledge of pharmacokinetics and the role of CYP450 enzymes in that drug metabolism. This is going to be super important for understanding drug interactions, potential adverse effects in the psychiatric care. All right, let's go ahead and try another one here. A 22-year-old male schizophrenic patient is a known one-pack-a-day smoker and recently decided to cut back and reported the decision to the PMHNP during the follow-up medication appointment. The patient is currently taking clozapine or Clozaril, 400 milligrams a day, administered in divided doses, which is appropriate. What is the priority action of the PMHNP? So priority means immediate. What do I do first if I have a patient that's taking Clozaril that used to smoke and now isn't? I rephrased it, and I come up with my answer, and I go through each one of these to see which one is closest to the answer I make up in my head. So is it A, decrease Clozaril, B, increase Clozaril, C, discontinue immediately, or D, congratulate the patient on his accomplishment? All right, the answer here is going to be A. We need to decrease clozapine. So cigarette smoke, remember, it contains those polycyclic aromatic hydrocarbons, and this induces the cytochrome P450 1-alpha 2 enzyme. So clozapine is metabolized by that enzyme, and smoking increases its clearance. When the patient reduces smoking, 1-alpha 2 activity decreases, leading to increased clozapine levels in the blood, thereby raising that risk of toxicity. So the PMHNP should monitor the patient's serum clozapine levels closely to reduce the dosage as needed. We don't want to increase it here, right, as in option B, because reducing smoking, the metabolism of clozapine is going to decrease, and so potentially resulting in higher levels of clozapine in the blood. So increasing the dose would further increase that risk of toxicity. We don't want to discontinue immediately because abruptly stopping clozapine can lead to severe withdrawal symptoms in psychiatric relapse. So a gradual reduction is appropriate if the medication needs adjusting. D, congratulating him while supporting the patient's efforts to reduce smoking is important. Immediate action is necessary to adjust the clozapine dose to prevent potential toxicity. All right, great job with those. So understanding antipsychotics is going to be the focus of our next example here in our coursework. And understanding the antipsychotic, this really works to have a good grasp on dopamine pathways in the brain. especially when treating conditions like schizophrenia. So let's break down these pathways and see how dopamine blockage affects different aspects of the body. All right, so schizophrenia, I remember this as being positively negative. We have positive and negative symptoms of schizophrenia. All right, schizophrenia is often described as being that positively negative because of those positive and negative symptoms, like hallucinations on the positive side or lack of motivation on the negative. Antipsychotic medications are going to target these symptoms by blocking dopamine in specific brain pathways. So here's how. First is the mesolimbic pathway. Dopamine blockage in the mesolimbic pathway results in a decrease in hallucinations, delusions, and other positive symptoms that are associated with schizophrenia or other psychotic disorders. So this makes the mesolimbic pathway a key target for antipsychotic medications, helping reduce those intense disruptive symptoms. Second is the mesocortical pathway. Blockage in the mesocortical can lead to negative symptoms, which are there present whenever a patient has the schizophrenia. So this is going to help with those negative symptoms, such as diminished energy, lack of motivation, restricted emotions, and changes in social engagement. So these effects explain why some of these patients on antipsychotic medications, see results from these antipsychotics within the mesolimbic and mesocortical pathways. Third is the nigrostriatal pathway. So when dopamine is blocked in the nigrostriatal pathway, it can cause extrapyramidal symptoms, or EPS, which are movement-related side effects. So these can include tardive dyskinesia, or involuntary facial movements, Parkinsonian-like symptoms like tremors, muscle rigidity, and difficulty initiating or stopping movement. It's one of the reasons why monitoring for EPS is so crucial when prescribing antipsychotics. And then 4 is the tuberoinfundibular pathway. So blockage in the tuberoinfundibular leads to hormonal changes. It causes a decrease in follicle-stimulating hormone, or FSH, and an increase in prolactin levels, which can result in these side effects such as amenorrhea, which is the absence of menstruation, gynecomastia, or breast enlargement in men and women, sexual dysfunction, as well as galactorrhea, or milk production. So these side effects impact adherence to medication because these are obviously very distressing, especially for men with breast tissue development and women for disruptions in menstruation, and for both, that sexual dysfunction. So it's important to monitor and address with the patients so that way they don't stop their treatment, and you can come up with alternatives or other ways to help support the patient. All right, so first generation or typical antipsychotics, also known as potent dopamine blockers, they block almost all dopamine receptors, D1 through D5, throughout the brain. While this makes them effective at reducing positive symptoms like hallucinations and delusions, they often come with significant side effects due to widespread dopamine blockage. So examples here are going to be haloperidol, Modicate, Thorazine. Now, because they block dopamine so intensively, these medications are more likely to cause EPS and other side effects, such as muscle rigidity, tremors, making them less desirable for long-time use. Second generation or atypical antipsychotics. So these second generations work differently. They block both the D2 dopamine receptors and 5-HT2 alpha serotonin receptors. So by blocking 5-HT2 alpha receptors, atypicals can increase dopamine level areas in the brain where it's needed most, so helping to reduce the negative symptoms and side effects commonly seen in schizophrenia and what can happen with typical antipsychotics. So this dual action makes atypicals more effective for treating positive and negative symptoms of schizophrenia, with a lower risk of movement-related side effects. Why does this matter? So the key difference is that atypicals offer a more balanced approach to treating psychosis, targeting dopamine and serotonin in a way that reduces those side effects and then improving overall symptom management. So let's take a closer look at some of these more common second-generation or atypical antipsychotics with treating schizophrenia and other psychotic disorders. So these medications, remember, they block D2 and serotonin, 5-HT2 alpha, that balanced approach to manage positive and negative symptoms. So here's a quick list. I won't read them out to you. You can see them and start to memorize. We've got all kinds of flashcards available for these in the online student portal. But I did want to point out these three specifics, the ziprasidone, aripiprazole, and lurasidone. I call these the ZALs. So ZAL, she's a skinny gal. And these three medications, second generation antipsychotics, they have fewer instances of weight gain. Thus, ZAL, she's a skinny gal. Now, we can't talk about antipsychotics without discussing neuroleptic malignant syndrome. This is a serious but rare side effect of antipsychotic treatment. This is an emergency situation that the PMHNP must be aware of. Now, NMS is more common with first-generation antipsychotics, especially medications like Modicate and haloperidol or Haldol. So key features of NMS are going to be extreme muscle rigidity and mutism. I like to call it the M&Ms of NMS. Patients with NMS often experience that severe muscle stiffness and may become mute or unresponsive. Then we have fever and autonomic instability, so high fever, rapid heart rate, blood pressure fluctuations, and sweating are often common. So you do have to monitor some very specific laboratory tests and findings. So if you do suspect NMS, you need to order the increased creatinine, or you want to order that CPK panel. You want to look for the rise of this, and this is because of muscle destruction. This is that hallmark sign of NMS. So we're going to see increased CPK. Then we have myoglobinuria. This is the presence of myoglobin in the urine caused by muscle breakdown, or what's known as rhabdomyolysis. This indicates severe muscle damage. We can have increased white blood cells, also leukocytosis. So this is an elevated white blood cells suggesting an inflammatory response. And then we look at elevated liver function tests, or your LFTs. So AST and ALT levels may be increased, and that can indicate some type of liver stress or damage. So why is this important? NMS, like we said, it's a life-threatening condition that is going to require immediate medical attention. So if you suspect it, the first step is going to be to discontinue the antipsychotic medication, and then we're going to provide for supportive care, and that could include things like hydration, temperature control, and monitoring for further and worsening complications. So one effective way to remember the key symptoms of NMS is by using the fever mnemonic. This helps you quickly identify those characteristic patterns of symptoms. So fever, encephalopathy, vital sign instability, elevated enzymes, and rigidity. So recognizing these fever symptoms, that helps you early detect NMS, and then we can immediately intervene and hopefully save the patient from a lot of dangerous situations associated with this serious issue. All right, now how do we treat it? So once NMS is identified, it's going to be important to initiate appropriate pharmacological treatments to manage the symptoms. So two key medications typically used for NMS are going to be first, bromocriptine. This is what I call bromo. It's a dopamine D2 agonist. It helps counteract the dopamine blockage caused by the antipsychotics because it's an antagonist of dopamine. It works by stimulating dopamine receptors. Remember, agonists activate, and that's going to help reduce NMS symptoms as dopamine now becomes present in those receptor sites. All right, then we have dantrolene or Dantrium. I abbreviate it as DAN. So this is a skeletal muscle relaxant, and it's used to relieve those extreme muscle rigidity associated with NMS. So it helps relax muscles and reduce the risk of complications related to severe stiffness. Now, an easy way to remember this is a simple mnemonic to recall the pharmacological management of NMS, which is bro, as in bromo, you've got NMS. Dan, as in dantrolene, relax, I'll be fine. So by remembering this phrase, you're going to be able to quickly recall those essential medications that are needed. All right, so remember, prompt treatment with these meds and any other supporting medications or actions is going to have a significant difference in the patient's outcome. All right, so we are now into the practice questions section of this presentation. So this is going to be an opportunity for you to just go out there, try 3 questions with us today where it's a safe environment. And just remember, you don't need to panic, all right? When you're practicing these questions, panic is not an option. We all get nervous when we take a test. But if you will utilize the test-taking strategies and go through and do this entire program and do all the practice exams, you're going to be confident in here. Remember, you want to narrow it down to 2 possible right answers, or that 50% rule. Remember, culture is important. Quality of care is a nursing goal. Conflict management is a goal in nursing, and you want to see that root word. Let's, for example, say it's assessing, and then you want to match the answers to that action. You want to be wary of absolutes like all, nothing, every, because those are usually wrong or send you down an opposite direction. Remember that critical thinking is important. As a PMHNP, we're not nurses in this process, right? We are the decision makers. We are the care plan implementers. So you got to be able to critically think. So if asked to refer or consult with someone else, then it's most likely not the right answer unless it goes outside your scope of practice. Safety for the patient and others is usually the right answer. If you see initially, remember in that stem of the question, you want to refer back to the ADPI process, and you want to go assess and then diagnose, so on and so forth in order. Evidence-based is massive. Choose those evidence-based answered questions, and then use the Prometric tools such as the highlighting, scratching out, and flagging questions to come back to later. All right, so let's go ahead and practice this. First question is, a new 48-year-old male presents to the PMHNP clinic for an initial appointment with complaints of irregular heartbeat, shortness of breath, and dizziness. During his interview, the PMHNP notes a mental health history of depression and obsessive compulsive disorder, or OCD. Which medication, discovered during the medication reconciliation, does the PMHNP consider as the cause of his current signs and symptoms? So what medication is causing irregular heartbeat, shortness of breath, and dizziness? I'm thinking to myself, a person with depression and OCD is more than likely on an SSRI, so that's kind of what I'm going to be looking for first. So I go to my answers. I look at A, escitalopram or Lexapro, 20 milligrams, paroxetine or Paxil at 60, citalopram Celexa at 60, and bupropion at 450. Now, Lexapro is an SSRI, I'm going to keep it. Paxil, I'm going to keep it. Celexa, I'm going to keep it. All SSRIs. Well, Butrin is an NDRI, or a norepinephrine dopamine reuptake inhibitor, so that one I can get rid of. Based on these three, because they're all in the same class, I have to also look at the amount that's been given. Is 20 milligrams appropriate for Lexapro? Is 60 appropriate for Paxil? Those are. And so when I look at 60 milligrams of Celexa, then I can understand those irregular heartbeats, breath, and dizziness complications, because Celexa at 60 milligrams is too high. So that dose is going to cause QT, interval prolongation, irregular heartbeat, dizziness, and cardiovascular complications. This is in patients over 60 or with pre-existing heart conditions. Remember, older patients need 20 milligrams at most. All right, good job on that question. Let's try number 2. So following 2 months of psychotherapy, the provider, patient, and her parents decide it would be beneficial to initiate pharmacological adjunctive therapy. So which of the following medications would be appropriate for a 15-year-old female patient with a known history of depression? All right, so what do I give a 15-year-old female that has been in therapy but now needs medication and has depression? Again, depression is commonly given an SSRI and potentially an SNRI for first-line treatment of depression. But what does it mean to be 15? So we have to look at that as well. So I'm looking for an SSRI that was associated with adolescent care. A, bupropion. I'm going to get rid of that one. That is an NDRI. Prozac, fluoxetine. I'm going to keep it. It's an SSRI. Cymbalta, duloxetine. It's an SNRI, so I'm going to keep it for now. And then Elavil, or amitriptyline, that is a TCA, so I'm getting rid of that one. So that leaves us with our 50% of B and C. All right, so the correct answer in this situation is going to be B, fluoxetine, because this is an FDA-approved treatment for major depressive disorder in children and adolescents aged 8 years and older. It's often that first-line pharmacological treatment for adolescent depression, and that's because it's due to its established efficacy and safety profile. So let's look at those other options. Remember, bupropion, it is effective for treating depression, but it's not FDA approved in peds. Cymbalta, again, primarily used to treat depression in adults, but not approved for treating in adolescents. And then Elavil, that historically is given for depression. It is a higher risk of side effects and potential toxicity, especially an overdose. And so that makes it an unsuitable first-line treatment choice. Now, it is also worth noting that the placebo effect in children and adolescents is a very big aspect when talking about depression medication trends. And this is when we compare it to adults. So this placebo effect making the response to genuine medication more significant in this age group. So currently, the only FDA-approved antidepressant for teens with depression is Prozac and Lexapro. Additionally, it's important to remember that many parents are understandably hesitant to enroll their children in research studies involving medication, and that's where we get this placebo effect complication. And that's going to limit the experimental data that's available within that younger population. All right, last practice question in our free session here. A 25-year-old male presents to the mental health clinic with complaints of gynecomastia following initiation of antipsychotic medication after an acute psychotic episode and inpatient treatment. The nurse practitioner understands that this is likely caused by the medication's effect on which area of the brain. So I'm rephrasing here. 25-year-old male complains of gynecomastia. When he starts an antipsychotic medication, where is this happening? What's causing this to occur with this antipsychotic? And I remember there's 4 areas of the brain. Unfortunately, they're all listed here, so we have to consider all of them. Is it A, the tuberoinfundibular pathway? I'm going to keep that one for now because I think that has something to do with hormones. B, the mesolimbic pathway. Now, I know that the M and the M's are going to be for positive and negative symptoms respectively there. So B and C can be eliminated right away. And then D, the nigrostriatal pathway, I'll keep it as one of my 50. So I've got A and D. Now, I remember that the nigrostriatal pathway is associated with Parkinsonian-like or movement complications. So that leaves me with my only choice of A, the tuberoinfundibular pathway. All right, and so that pathway is, sure enough, involved in the regulation of prolactin secretion from that anterior pituitary gland. So antipsychotic meds, especially those that block full dopamine, are going to increase the prolactin levels, and then that's going to lead to side effects like breast tissue development, milk production, menstrual disturbances, and sexual dysfunction. All right, good job getting through all of those. So we're rounding out here. We're going to go ahead and end this session today. I just want to talk about a few more helpful tools that are available in the student portal as part of the PMHNP program. So we have all kinds of flashcards, medication flashcards, main topic flashcards from the seminars. There's really thousands of them in the student portal. But these are very nice. You can download them and cut them out with instructions and then utilize these flashcards throughout your study. Here's an example of the other flashcards that just kind of touch on definitions and main concepts and ideas. So very nice, again, very clean and organized. Okay, one thing that's really important here is what we call our cheat sheet. So once you start your exam, remember I told you at the beginning today that you're going to have about 20 minutes of instruction review time. Read through those really fast, but I've already taught you everything. And then you're going to use your cheat sheet. So once you've finished your reading, a quick overview, you want to data dump your cheat sheet before you go to that first question and your time starts. So you're going to learn about each of the topics on the cheat sheet in each of the seminars. You're going to memorize the cheat sheet and practice using the fill in the blank form that's in the back of the study guide for Seminar 1. And you're going to do it over and over and over again until your muscle memory kicks in and you can write down everything on your whiteboard that's on the cheat sheet. All right, so you will refer to the cheat sheet many times during the exam, and that's going to help quickly trigger your memory and answer questions in less than 30 seconds for things like scales or Erickson's, Piaget, Freud, BMI. Going to be a very helpful tool. You want to make sure that you have a printed copy with you throughout your seminars when you're in the program so that you can refer to it often. Here is an example of that cheat sheet. You can see the scales on the fully filled out version, and on the other side here is the blank version to just kind of give you a prompt and you start memorizing this. I would like you to get to the point where you have a blank sheet of paper and you're jotting this all down by memory, and you don't even need the blank sheet. All right, then we also have something that's called our updated exam tips. This is a monthly newsletter that I put out that focuses on information that students that have passed the exam within that last 30 days and what they identified on the exam and what topics they think we should add or change, and just in general what some of the questions were about. Now, we're not giving you the exact questions here because we want to maintain our integrity, but this document is going to give you a live, up-to-date look at what's being seen on the exams today. And that is on the main page of your student portal. It goes back for a couple of years now. You've got all of these great focused tools with the updated exam tips that come out monthly. All right, if you've stuck with this far, you want to know the pricing. And this is a really important area for me because, when I was preparing, I was a father of 7. My wife stayed at home and did the most difficult job of all and was a homemaker. I worked while I was in school, and so my money was really precious to me. I didn't have a whole lot of it. So one of my commitments is that I am constantly looking on the internet, looking at other programs. You will notice that our program has way more material available to you and your differing study styles than any other program out there. And my goal is to always have our cost lower than everyone else. So our pricing here is going to include that 6 or 2 week completion. We give you up to 6 months of access to the student portal. There's even a 12-month option or a 2-week kind of crash course. The full review is going to include study guides, flashcards, practice tests with answer justification. You're going to have 6 175 question practice exams, and we are often adding to that. So there could be a 7th, 8th, a 9th, or a 10th. And this is going to help you prepare for that actual exam. It's going to give you an opportunity to practice timing, stress reduction, and build confidence. All right, and here's where we're at. So our 6-month option that will gain you access to all the material for a 6-month period of time on the student portal. And you can go into the student portal as much as you want, take the seminars as many times as you can, listen to it in the car like a podcast, watch it on the video with the slides, take the test as many times as you want, and that's for $375. The 12-month option, a lot of students do this in the last semester of their course to kind of help them for their exit exams and to prepare for the certification. That's $450. And then we do have that 2-week on demand. I only recommend this 2-week option to those that are very confident in their test-taking skills, their strategies, and the content. Because it's not, 2 weeks is pretty short, so make sure you have a good grasp if you're going to use this kind of crash course, and that's $275. Now, we also offer live in-person PMHNP reviews that also include a virtual attendance as well. So here you're going to get an unparalleled live course that's interactive with other students and with me as your instructor. We're going to be live in person. We're going to cover all the PMHNP domains for both exams. We're going to do a real deep dive, and based on your questions and interaction, we'll go even deeper than what's in the program. You're going to get a copy of the printed guides and the Answers with Rationales manual for you to take home. You're going to be able to access all exams. The live in person is a 2-day event. It gives you 3 months of access to the student portal for a follow-up online studying. There's snacks, swags, and more. The beauty of this is remember, our program is accredited by the AANP, so this will fulfill your requirements for the on-demand portion to get you continuing education. So you can go to PMHNPtesting.com for all of the currently scheduled conferences. We now have them all planned out for the rest of the year, and that will get you some more information about where we're going. So course pricing here, remember this does not include hotel, travel, or meals. That's all your responsibility. But the 2-day conference, the standard pricing up to 3 weeks prior to the event is $595. There is the in-person virtual attendance option that doesn't include the printed materials for $495. And then the final price, if you wait till the last minute, it does go to $665. And that's because we have to make sure that we have enough seats. And so we may need to change the venue or the venue setting within a hotel or a conference center. So the price does go up to $665. But very affordable for a 2-day conference. Live in person with continuing education and printed materials. They're a lot of fun. They're probably my favorite thing that we do in the coursework. Okay, I do offer a 100% pass guarantee. Now, what does that mean? Does it mean that I guarantee that you will go and sit down and ace this exam? Unfortunately, I can't make that type of guarantee because the study habits and your commitment to being ready is all on you. I do guarantee that we provide you with everything that you need to prepare for this exam and be familiar with the concepts and test-taking strategies. But I will promise you, if for some reason you don't pass, and that's okay, some wonderful providers that I know had to take the exam multiple times, but we're going to be there with you. You will be with us until you pass this thing. We're going to make sure that you've got the information that you need, and we're not going anywhere. You will not owe us a dime. You will stay in our program until you pass the exam. One of the other things that we've started to do recently is a live session on Wednesday nights at 7 p.m. Mountain Standard Time. And we typically practice 5 practice questions, and we talk about the reasons and rationales of those questions. And then we have an open forum for you to ask any questions or have any thoughts of your studies during that week. And so we do offer this kind of live interaction so that you feel like you're a part of something and not just in an on-demand if you didn't do one of the live sessions. So that's our 100% pass guarantee. I love t-shirts, I love swag, and I love being a PMHNP. So one thing that I want to do is send you a free t-shirt whenever you pass your exam. You'll call and let me know. We're going to celebrate together. We'll have you conduct a survey. If you feel like we gave good service and a 5-star rating, you'll be able to provide us with that. And then I will send you this free t-shirt to brag and show your pride in being a certified PMHNP. It's just a gift from me to you. An additional service that we have is personal tutoring is available. This is one-on-one mentoring that's conducted via Microsoft Teams. It's a coaching session. It starts at $85 an hour, and it's tailored to you. It's your own personal study. So it's one-on-one. Great opportunity if you're struggling in your exit exam for your course or preparing for the certification exam. We do have the printed study guides and printed answers and rationale manual now available. This is an add-on purchase. If you're like me and you want a spiral bound and it's printed on, heavy 28-pound paper, I want to be able to highlight and write and feel it. The study guides you can download and print off of the student portal for personal use. The answers and rationale is only available in virtual option in the student portal, but you can order it here in paper format. So just an additional tool. If you want paper and you don't want to copy and bind it yourself, we will do the work for you. There is so much more in the seminars. I can only talk about so much here in our free information seminar, but it is a great opportunity for you to practice your craft and your art as a PMHNP while you prepare for and study to pass the PMHNP certification exam. Because you're still here, I did want to offer you a discount code to just save you a little bit more money as a thank you for listening to our presentation today. When you check out at PMHNPtesting.com, just go ahead and put in the coupon code PMHNP ready, and that will get you a discount on your package for studying. And it doesn't matter if it's capitalized or not. That should put that discount for you and save a few bucks. These are the references that were utilized in today's seminar. Again, thank you for being here. I'm Dr. John Rossi. I love what we do as PMHNPs, and I love working with students and those that are preparing to go out and do this amazing work. I am available via telephone, via texting, via chat on our website. You can also call me on my personal line. I will be the one that you talk to. If you're going to put your trust in us for your studying, I want you to talk to me directly. All right. Thank you again for being here. We'll see you in the seminars. Bye-bye.